Hello everyone, welcome to our podcast channel Mirrored on Mirror. Today we are talking about a very special topic which nobody talks about, and that's type 1 diabetes. And we are talking about this topic in a special segment, The Way Forward, for which we have invited Nupur Lalvani, who has been an ambassador for type 1 diabetics and has created a support system and ecosystem for them to survive and live a carefree life and with total dignity. So over to you, Nupur.
Thank you, Avinash. It's a pleasure to be here with you today, and for our favorite city newspaper. So I have type 1 diabetes, and I've had it since childhood. For the past 29 years. And like Avinash mentioned, type 1 diabetes is an autoimmune condition. So when people say diabetes, they only understand one type of diabetes, which is commonly type 2, the most common type in the world. And in India, we have over 101 million people that live with all types of diabetes. So I am one of those 101 million, but type 1 is a lot less common than type 2.
So when we talk about type 1, so what are the measures that you can take to control it, or because that's something that you are born with, or since it's an
Yeah.
autoimmune condition. So maybe you catch up later, like somebody, we have a classic example of Wasim Akram,
Right.
who was diagnosed at the age of 30. So what are the kind of precautions, or what can be done, like
Yeah.
to control it or to live with it?
Yes, I actually want to thank you for this question, Avinash, because I think it's so important. People, we don't realize as the common man what the symptoms are. So when I was not diagnosed yet, my symptoms were excessive thirst. I was drinking water all the time. My family was very happy. The child is drinking water is a good thing. I was going to the washroom a lot. So frequent urination is the second thing. The third thing is intense hunger. So I was eating more rotis than my father at some point, and I was only 8. So it was I think for the family it was a little confusing. They didn't know that these symptoms correlate to diabetes. This is not commonly known,
Right.
not just by people but also sometimes by healthcare professionals. So the diagnosis
Right.
gets missed, and in the worst case scenario people have also passed away. 4 years ago in our city in Pune, an 8-year-old boy did not get diagnosed in time, and in this day and age in our city, the child passed away in Pune. So I feel very lucky that my parents insisted on getting me checked. My father noticed and realized that actually in my case there were black ants in the
The washroom.
toilet in the washroom, and that's when it struck him that maybe it's diabetes. Our doctor said at the time that children don't get diabetes. But when
Right.
my blood sugar was checked, it was 636, which is like more than 6 times normal. Uh,
Good level. That
so
should be level.
yeah, so these are the symptoms of diabetes, and if any of the viewers have these symptoms, they should visit a pathology lab. They should speak to their doctor. They should get tested immediately.
So, like you said, it's life threatening as well. So, do you think our healthcare facilities are up up to the mark, to diagnose it at the right time, especially in the rural area?
Yes, I think there are some great things that are happening, and those need to be acknowledged. One of the things I want to highlight is the government has something called the Jan Aushadhi Kendra, which is
Right.
basically public generic chemists
Medicines.
by the government, and there are I think 8 or 10,000 of these across India. I got to know of this a few years back, but not as far back as when it was launched. I think in 2000. I'm not very sure, but I think 2008 or so it was launched. I definitely did not know then. So a lot of the medication there is available at 50 to 90% cheaper, and it's the same chemical composition as the branded
Oh,
medicines. So there are few good things that are happening. I think our public healthcare system, in terms of non-communicable diseases like type 1 diabetes or type 2 diabetes, really needs a relook, because there's a lot that needs to be done. For somebody who has type 1 diabetes, they need to take insulin injections 4 to 6 times in one day. They need to check their sugar on a glucometer 5 to 7 times in one day. And who's going to pay for all this,
right,
especially like you said in the rural areas.
right,
Many times we've come across parents who say, I don't want the child. I have 3 children. I have many mouths to feed at home. Do something. I don't wish to keep the child at home. So it's not just the problem of medication, which is obviously the big one, and it's something where governments need to be involved, but it's a lot of other things. It's also social stigma. It's like, people feel like they have done something wrong, which is why the child has got it. Maybe the mother is blamed in some cases. So it's a complex condition. And I think, one other thing I wanted to say was, every year the United Nations has a high level meeting on health and other things. The United Nations General Assembly that takes place in New York. This year is very important because the meeting is on NCDs, which is non communicable diseases.
Okay.
So, there really needs to be some engagement. Governments need to recognize that this is, so several years back, infectious diseases, especially in our countries, in India and other South Asian countries, infectious diseases were the problem.
Right.
Tuberculosis, HIV, other problems were, the focus of the mainstay of the government, where you give one medication and the patient is cared for.
Right.
But NCDs are really accounting for more than 70% of deaths globally. So,
Right.
and more so in our countries. So, really, there needs to be some way that communities like ours, of patients who actually live with the condition, governments, other people, doctors and scientists, need to come together to work on solutions that can not be a burden to the state but also help the patients.
Okay. So personally, what I have realized, type 2 diabetes, again, there are so many things to
Mm.
have that diagnosed. So it could be due to bad lifestyle.
Yeah.
Something would be maybe it has come through parents, so
Yeah.
it's genetic.
Correct.
But type 1 is something that you have to live with it. It's diagnosed mostly at the early stage.
Yeah.
But nobody looks at type 2 diabetes as something alarming, or there's no social stigma attached to it. But type 1 diabetes, where the patient is not to be blamed at all, because it's not his or her lifestyle, but it's just they're born with it or they're later diagnosed for it.
Yeah.
So why is it that type 2 is still acceptable and type 1 is still considered like, it shouldn't be, accepted?
Yeah.
It's not accepted anyway. So what's your take on that?
Yeah. In our community, we've had friends who say that they are in a restaurant, and the waiter has bought their pohe or whatever it is that they're eating, and they take out their insulin injection to inject, because in a non-diabetic's body, your pancreas is producing insulin
Right.
as soon as you eat. But in our body, we need to externally inject. That's the
Right.
only difference. And we need to do this to survive, like you said, without it, there's no survival. So this boy removed his insulin pen, and he was about to take it, and the waiter went and complained to the manager that he's taking drugs. So these kind of things, it's a lack of education, it's a lack of unawareness. There's some little bit of compassion towards a fellow human being. I think these things really would go a long way. And sometimes I feel like, as a society, like our culture as Indians, is also that we may not want to talk about something that is a little taboo or uncomfortable. People have several problems. People are not able to find a partner to get married, for example. So when we started our community, Blue Circle Diabetes Foundation, it was primarily for patients to connect and learn from each other, and that kind of thing. And the focus was diabetes. But we realized these fringe topics are, they're very important to the patients. They're very important to other people like us. And so then, we've created platforms where people can talk to each other, find partners, live a normal life and not feel that pressure of society. School children don't get admission sometimes due to type 1 diabetes, which is why it's very important for the government to recognize and acknowledge it. And I think there's been some great work. We've been involved in some discussions with NCPCR, which is the National Commission for Protection of Child Rights in New Delhi. So, we've, over the years, many communities, including ours, have been in talks with them. A year or two ago, they sent out a directive to all the boards, to CBSE, ICSE, Kendriya Vidyalaya, every single board in India, saying that if a child with type 1 diabetes is in your school, you must support them. You must, if needed during exams, give them a little extra time. So there have been some good things that have happened, but I think that we have a long way to go overall as a society also. When we travel abroad, people might not throw garbage on the floor. They'll be careful because everyone else is throwing it in the dustbin. I think it's the same logic. How we treat another human being also is probably a result of what other people around us are doing.
Very rightly pointed out. And in fact, I'm part of that Facebook group. You had added me
Yeah.
a few years back. So you all are doing an excellent job there. And the kind of community that you have built, it's commendable. I read a lot of discussion and so many happy stories. So, I mean, keeping the stigma aside, there are so many success stories as well.
Yeah.
Like people are working out weight training, people are running marathons. So, it like what's your take? I mean, they can be equally active and like they can do anything that other sports person can do, right?
Yes, absolutely. And you rightly pointed out Wasim Akram, his example, and there are so many achievers. There's like internationally, if you see, there's Nick Jonas who founded Beyond Type 1. There are people that are achievers in every field, and we often counsel parents. We also have a free helpline. Since the time COVID started, we started a psychosocial helpline, which is led by people who have diabetes themselves. So they understand, and there's this barrier to seeking mental health help. I mean, of course, because it's expensive also, but also because there's, like you said, a stigma around a lot of
Right.
these things. So we talk to people and we tell them, a couple of years back there was a parent from Pune, and she wanted to pull her son out of skating, and he was at that time already a district level athlete. He was 8-10 year old child at the time. Now he's like, I don't know what, 15, 16, and he's participating in squash and skating at national level and doing so well.
Wow.
There's no sort of boundary or barrier to you can become the prime minister if you have type 1 diabetes. I mean, Theresa May in the UK was prime minister of the UK some time ago. So we often tell parents that it's a manageable condition. You just need to be on top of it, make sure blood sugar levels are managed well and controlled. And of course, if you go on the internet and look for what can go wrong, there is a lot, but then on the bright side there are.
Yeah, we have to always
Yeah.
focus on the bright side.
Yeah.
So there's another question that lingers on my mind is since this is a daily doses of medicines, so what about the finances? What about the affordability? I mean, can someone with a really humble background manage the condition
Un-
seamlessly?
Unfortunately, it's going to be very difficult for somebody who cannot afford I mean, even though we're a country for massive population, I often get invited to speak at meetings and conferences, and I tell people that our diabetic population is actually larger than several countries entire population. And it's difficult, accepted. It's difficult for governments that are already pressed for distribution of, like,
Funds.
of course, yeah, funds need to go to development and making roads. But if you don't invest in your people, there's no way that that the country is going to prosper, because so it's very, very difficult. And earlier on I was talking about the Jan Aushadhi Kendras, so that's one good thing.
Right.
But they're not there everywhere, and in fact in the rural areas they are probably more sparse than they are in the city. I know
Right.
Pune has so many, but I'm sure when we step out of Pune, it's probably not there as much. And so then what options do patients have? They can go to the local government hospital,
Right.
but certain state governments do share analog insulins, which are modern recommended insulins for people with type 1 diabetes to be used. So there are state governments of Goa, Uttarakhand, Telangana, etc., who disburse these for free of cost to every patient, irrespective of their socioeconomic background. So, our endeavor as a patient advocacy group has been to speak with the Maharashtra government as well, to engage with them over the years on this matter. And, we understand that the population is huge, but something really needs to be done, because where do those people go?
Right.
They'll either have to come to NGOs like us or like several others, or some kind of rely on some charity. But I think health is a human right, and everybody
Correct.
should be able to achieve
Yeah.
their optimum capacity of living healthily and happily.
So when you talk about generic medicines, so it can be restricted to insulin or some pills around it or
Yeah.
something similar. But when you talk about the glucose monitoring system where the insulin is being pumped as the sugar level drops
Yeah.
or rises, so that's one thing that's expensive, and that's one thing where a government and obviously the pharma company
Yeah.
should have a amicable arrangement.
Correct.
Where it becomes affordable. Right now in India most of them have mobile phones,
Yeah.
and these things can be monitored on a mobile phone, can be tracked.
Yeah.
So, is there any way this, the glucose monitoring system or anything can be subsidized?
Yes,
You know?
actually, would like to also show you, Avinash and the viewers that what a continuous glucose monitor looks like. So I'm sorry, but here it is on my arm. It's like a coin-sized device. There is so a lot of people think it's non-invasive, but actually it is invasive because there's a small needle, a small
Needle.
filament that stays in your body, and it measures something called the interstitial fluid in the blood. So when you use a glucometer, you're using capillary blood. When you go to the pathology lab, you're using blood from the vein, but when you use a CGM, you're using interstitial fluid to measure the sugars.
Okay.
Now these are very expensive devices, and another thing that we've been really pushing, because we are consumers and patients both, and I think there needs to be, like you rightly said, a cap on how much can be charged, because on an average, these cost about 5,500. They last for only 14 days, and so that really cuts out most of the people who need to use it, who are insulin dependent or who have diabetes in general. So I want to share an example of how we tried engaging with one of the companies that produces these CGMs, and there was a CGM that was slightly more affordable, and that was pulled out of the market in February this year. I mean, everybody knows the Abbott CGM, the Libre, which is widely marketed. It's available on Amazon also. It had a slightly lesser expensive cousin called the Libre Pro, which costed about half the price, and a lot of patients were using it. That was pulled out without any intimation. Usually there's a press release or there's some sort of information that is put out in the public domain. To the best of my knowledge, there was no such information. It was pulled out. We requested the company, but long story short, I mean, it was probably part of their sort of business plan to pull it out eventually. But the fact of the matter is that currently patients don't have access to an affordable continuous glucose monitor. And really, the prime minister talks about make in India. We as a country, we want to encourage that sort of build industry, but I don't see where's the development happening. Like, there are some companies that have reached out to us, spoken to us, taken our feedback, but there seems to be nothing moving fast enough. And we are 101 million diabetics. We are one of the largest diabetic populations in the world, second to China. So it's a huge business opportunity as well. And if it's priced fairly and correctly, then I think people will really be able to manage their sugars. Because one thing is, like you said, either taking medicine or taking insulin, but without knowing your sugar, if you're taking insulin, it is one, very dangerous, and two, it's like driving a car with your eyes closed.
Yeah. From hypo to hyper,
Yeah.
you don't know what was going to happen next.
Correct.
So, I think ideally this should come to the generic medicines.
Yeah.
That will be a success story when these things
Yeah.
reach to the generic medicine stores.
Yeah.
So, talk about the Blue Circle Foundation, and since you are doing such a good job, so is it restricted to Pune or it's all over India?
So it's all over India now. We started several years ago in Pune actually, and started doing fun things, like nothing serious at the time. Just like, okay, let's. Are you diabetic? Are you diabetic? Let's all run together. That kind of thing. And one fine day there were like 150 people that showed up for a casual WhatsApp chat kind of a run. So from there on it started, and I actually ended up quitting my full time job. To eventually realize maybe it there is a gap. There's something that is missing. I'm a patient as well, like there's something that we're not getting from the healthcare system. Of course, not blaming anyone. Doctors are overburdened. There are too many of us as patients that, if you go to a government hospital, you probably won't get more than 30 seconds or 5 minutes of time. And how can we step in as a patient community to help each other? Because I've learned so much from others who have the same condition as me, that I realized that there is lack of an online space for people who have this. So when you're a young person, you're moving cities, you're trying to build your career, doing things, and I realized there was no sort of continuous support that was there. You were just figuring it out. Like if I was doing a night shift, my doctor would say, don't do it. but how can I not do it? I
Yeah.
still want to retain my job, right?
Give a solution.
Give a solution. So then I started understanding how do I measure my, my blood sugar, what sort of, how do I manage my dosing. It was completely on my own. So now the idea of the community is that people can help each other. It's not just in Pune. We do these monthly meetups across the country, places I've never been to physically, but right from Kanpur to Chhatrapati Sambhaji Nagar to every, like, lots of places across the country, north to south, east and west, and those many people have diabetes. They want support, they need help, not just about medical or physical things, but it's also about knowing that somebody gets me, like, someone understands. So that's how it started. But then since then, we've been doing a lot of things. We run something called Project Isha, where we support the underprivileged. We realize that we have our limitations. We don't have endless funds. In fact, we ask our community to step in and help if somebody needs to be given insulin or pen needles or something. But what we have an expertise is, so I want to share an example. An auto rickshaw driver in Mumbai, his daughter has type 1 diabetes, and somebody randomly reached out to us on social media, and that's also the power of the internet. So we not only help them with supplies, but also with a didi, like a person who has type 1 herself, and she can guide them. And that child's sugars and A1Cs have really improved over the last couple of years.
Wow.
So that's one. We run a free support helpline. It's called Buddy Project Helpline. People can also look at our website. We've got a Facebook group. It's called Diabetes Support Network India. We do a lot of school awareness programs also over the last several months. Over the last year, we've reached out to more than 10-12,000 students. So, Zilla Parishad schools, public, private, everything. Everyone needs to know that this can happen. Sometimes children can if the child can understand, he's going to the washroom often, he's drinking a lot of water, and if he knows this correlates to diabetes, that could save a life. He could tell his parents, get me tested because I heard this in school. So these kind of things as well. And we also have a mobile app actually that is created by and for diabetics. So with diabetes, if you're checking your sugar 10 times a day, you're taking injections 5 times a day, all of these are data points.
Right.
And either you write it down in a notebook, which is really old school and nobody likes that kind of thing anymore, or you put it on an app, let the AI help you a little bit, you use your own focus. So lots of things happening, a lot of advocacy also. We try and reach out to local policymakers. Before the Vidhan Sabha election last year, we created a diabetes manifesto. We thought, well, everyone's creating one. The tree lover groups made one. Everyone, other interest groups made one. So we said one for health, one for diabetes, and then we took it to local policymakers in Pune and presented it. And we've got some engagements and some promises, and I think now it's down to us to see how to take that forward. We also had opportunities to speak at the UN high-level meeting, also at the World Health Assembly in Geneva this time. I think internationally, patients are being recognized as experts, and I think there is no healthcare system without a patient. Like you could have, like we call experts, we say doctors, scientists, and they are 100% they're experts, but the expert of his or her own condition or own body is the person who has that
Who goes through it.
goes through it exactly. So that's kind of what we're trying to do.
So this podcast series is called Mirrored on Mirror.
Huh.
And there's a special segment. This is the part of that special segment that's called Way Forward.
Yeah.
So I just want to know, is there a stem cell therapy or something, like what is the way forward for type 1 diabetics? I mean, is there kind of researches that has been happening, like some kind of good news that we can hope for type 1 diabetics?
Yeah. I'll share two perspectives. One, when I was diagnosed close to 30 years ago, my family was told, don't worry, a cure is coming in 5 years. And, every 5 years we eventually started joking about it and, saying, okay, well, we've waited so many cycles of 5 years. But having said that, I think science is progressing. There are a lot of things incredible things that are happening. There's been stem cell research and all going on for decades now.
Right.
There have been clinical trials. In fact, there's one now by Vertex, which is happening, and it seems really promising, to the extent that some patients have gotten off insulin. However, in some cases, they are then put on immunosuppressants. Now, those are a class of drugs where, if you have a kidney transplant, for example, you get a new kidney, but then you have to eat a immunosuppressant tablet for the rest of your life. And so is that a trade-off that you're okay with? Maybe for me, maybe not. I'm actually quite happy with my life taking insulin. It's no problem. Like, I'm well settled now. But I understand, like, for newly diagnosed families and people, it's very jarring and very difficult.
Correct.
So, I mean, I hope that in the near future something breakthrough comes through. But until then, like, we've got to keep being hopeful and taking care of our blood sugars.
Yeah. So a person, living with type 1 diabetes. So what's the kind of kit she or he needs to carry?
Yeah. Yeah. So, I actually go nowhere without a bag. And that's like, some might think, oh, because you're a woman, you have to have a bag and, all that. But I don't know. Maybe if I were a man, I would still have to carry a bag because there's so many things. So I carry my insulin. This is called a syringe. We all know what this looks like. Old school people also use insulin pens. There are three ways to take insulin via syringe, which is old and cheap. Then there's insulin pens, and then there's an insulin pump, which is like a small pager that you keep on your body.
Okay.
And it pumps insulin
Automatically.
But you're able to, like, when you eat, you have to still tell it, I want a certain number of units. So there is progression in technology, but that comes at a cost. And, again, the question of affordability comes up. So this is glucose that I carry, and if my blood sugar... So,
Drops.
yeah, drops. So if it goes below 70, then I quickly need to eat this. Because if I ignore a low blood sugar, I could fall down, and there could be a medical emergency.
Yeah.
So I don't want to go too low, I don't want to go too high. Then I also have the CGM on my arm, the continuous glucose monitor. This must be familiar to a lot of viewers. This is a glucometer. Maybe at home, like somebody's grandparents or parents might have used it or seen it. And this is a pricker, and this is some more insulin. So the very stuff that our bodies stop making one day, we just have to inject that externally. So that's what's in the kit.
This was an amazing session, Nupur, and in fact, it's an eye opener to many. And I think people should start accepting and respecting type 1 diabetics. And I don't think there should be any stigma attached to it. And people should look at them like normal people, like everybody.
Yeah.
It is not something like you all have smoked heavily and it has caused some infection in your lung. That's something that
Yeah.
you're born with or later diagnosed. So thank you so much, Nupur. I would like you to share a good message, the way you want to sum it up for our viewers, please.
Thank you, Avinash, for having me here. It's a really, privilege to share thoughts. And I think I'd like to say two things. One, get yourself tested regularly. Do an annual checkup. Every second or third person in India has diabetes. So, prevention is better than cure. There's still a window of opportunity when you're pre-diabetic, when you can, take care of your diet and lifestyle and other things. And second, whatever happens, just know it's not your fault. Even if you do, like, if it's type 1, of course, that's autoimmune. If it's type 2 also, it's a combination of reasons. People are busy, they're working long hours at the job. It's very difficult to manage.
Right.
And these conditions are manageable. Find support, find a community, get yourself updated. Don't wait for somebody to come and tell you this is what you should do. Learn yourself and be proactive.
Thank you.
Thank
Thank you so
you.
much, Nupur.